to Beyond the Boundary Road. I'm Jadine Croft, and with me is language researcher Des Crump. Hi Des.
Hello Jadine.
Good to see you. How are you?
I'm good, thanks.
That's good. So, Aboriginal health has been a widely publicised topic for decades. Today, Des and I are going to see if there are ways to revitalise language in the current health situation. So we'll start off by asking, what's the correlation between the lifespan and language sustainability?
Well, there's a lot of research that says that the people who are strongest with their culture and their identity and have that connection back to country where they're from and feel good about who they are and their cultural identity, they tend to live a lot longer. What they're finding is the ones who are experiencing the poor health, especially in terms of social and emotional health and well-being, that they're suffering, I guess, everyday illnesses or ailments because they haven't got that inner strength, for want of a better word. And so they're also more likely to end up in juvenile justice or incarceration, and that because, again, it comes back to that sense of connection, that sense of belonging, and identity and culture and language are all part of that.
Yeah. So how does the health situation impact upon languages?
Well, I think, again, it's important that language is kept strong in communities, because that makes the community strong, it makes individuals strong, makes them feel good about themselves, and particularly if they can look at ways of bringing language into say health, like not just with body parts, but maybe even in terms of in-servicing health professionals who come into communities, training them up in language so they've got a basic, understanding of the language, and even perhaps using some of those body part names in helping diagnose and work out, well, what's the best way to treat Aboriginal people in that community. Yeah.
And is it important to have a list of health words in hospitals that are translated from a particular Indigenous language into English?
I think so. I think it would help, particularly in the remote communities where language is still strong, and some of the traditional people there may find English as a second, third, or even a fourth language, and so they might be able to describe their illness or their pain where they're sore in their own language, but may have a bit of trouble getting that message across in standard Australian English for the doctor to understand.
Yeah. So would you think having local First Nations people in the hospitals who have the language knowledge will help in providing confidence to the elders in attending the hospitals for general checkups and just learn more about health awareness?
Oh, definitely, because I think having Indigenous health workers, it helps break down that barrier, because sometimes hospitals and doctors' clinics are seen as a little bit of a mainstream institution, and some of our people have a bit of fear towards those sort of places. And I think if there's an Aboriginal or a Torres Strait Islander person working there, that helps not just only break down that fear, but it helps with that liaison with the community. It helps in terms of supporting and helping with any translation or interpretation, particularly if there's that language issue there, and they're wanting to, work out what's the best way that we can identify where the pain is, what level of pain it is, or illness, and how to treat that best.
Yeah. So Des, what are some words to describe health and well-being in your language?
Well, if someone's not feeling too well, if you're asked, how are you today, they might say gargle. So gargle means, I'm feeling bad, I'm feeling a little bit unwell, a bit sick.
Yeah.
If they're feeling a little bit out of sorts or not quite with it, they might say, I'm a bit naragar today. So naragar is more of a word that means out of sorts. And then there's also a word for tablet. So mostly for back in the days when astros were around, they came up with the word dalban, which means an astro tablet.
Okay, yeah. So can you give us some examples of natural medicines that were used by the Gamilaraay people, and what was the purpose of some of those?
Okay, well, sandalwood was used by quite a few groups in Gamilaraay, as well as being a smoking ceremony use and cleansing people if there was a death or an illness in a community, in a campsite. They would smoke that, but it was also used crushed up turned into added to water, turned into a liquid, and it was used for bathing sores and that, particularly things like scabies, school sores, those sort of ailments.
Yeah.
Wattles were also used for treating colds and flus, and particularly breathing in the fumes from the wattle seeds or the wattle leaves, but also crushing the leaves up, making them into a poultice and rubbing that on sores. But it could also be used as an inhalant by putting it in hot water, and someone, if they had a sore throat or clogged up nose, they could breathe through the wattle seeds.
Well, that was really informative and interesting. Thanks for that, Des.
Well, thank you.
So that's it for today. Next week, you'll be learning about the importance of the traditional family and how languages relating to it have evolved. So don't go away. Beyond the Boundary Road will be back right after this break.